Hello, this is Ashton, and this is Lola, and we're going to explain a little bit about what CF is like on a daily basis for you. So, Ashton, why don't you just kind of give a brief explanation about what cystic fibrosis is?
So CF is a genetic lung disease. You can only get it when you're born with it, and what it does is everyone has mucus in the lungs and their nose and everywhere, but we produce more of that mucus. And with all that mucus, they grow a lot more and more, but they grow faster than every other person's mucus would otherwise. It's the mucus in our stomach, and the mucus in our lungs, and the mucus in our sinuses, and all of it has to be treated somehow.
Yep, and it's a breeding ground for
Bacteria.
Yeah. So we get lung infections easier, they get sinus infections faster. And Lola, why don't you explain, like, when you're eating, why you have to take so many pills?
Well, my body doesn't digest nutrients and calories and fats and proteins as well as regular average bodies. So I have to take enzymes to help break it down so that the nutrients are absorbed and I can use them to fulfill life functions.
Yep. Ashton, how many pills do you take every day?
50 something.
Yeah. And Lola, about how many do you take?
It's like 45 or whatever.
Yeah, about 35, 40 pills a day. So, and then now we're going to demonstrate what a daily treatment is like. So Lola has her vest on, and almost all patients with cystic fibrosis have some sort of vest. So Lola's going to demonstrate what it looks like when she does this. And she usually wears a nebulizer on her face while she's doing it. And you can see it's kind of loud, and it shakes up her lungs so that she can cough up the mucus. Cool. Okay. And Lola, how often do you do this when you're healthy?
I do it 2 times a day to stay healthy when I'm healthy, and 3 or 4 times a day when I'm sick or have an infection.
Right, and each time is 30 minutes long. So, and then through her nebulizer, she gets about 3 or 4 different medications. So, okay, Ashton, what is the worst thing about having CF?
It's the time that it takes to treat yourself. Well, treat the CF. And the time it takes away from everything else.
Yep.
The whole going to doctors over and over and over again. Just time thing. Or the second would be pills.
Yeah, all the pills. Yeah, always having to have pills. And insulin. Ashton has to do insulin once a day, check his blood sugar several times a day.
Yeah.
And what do you have to eat, Lola?
I have to consume more calories and fats and proteins to get all the nutrients for my body.
Yeah, it gets a little old eating a lot of high-fat, high-protein food, right?
Ashton's lucky because he doesn't have to eat it all by mouth.
Yeah, Ashton has a tube feeding in his stomach, and every night he gets extra calories that way to keep him healthy. Lola did not have as many problems early on gaining weight, so she just has to eat it all with her lovely little mouth.
Although sometimes I would rather have it during glucose tolerance tests.
Yes, yeah. So every year is filled with testing and a lot of blood tests. They do a lot of throat swabs to check their lungs. They both culture MRSA, which is methicillin-resistant Staph aureus, which means that every time they're in the hospital, they are on contact restrictions. So everybody has to gown up and wear gloves and masks if they're around them. So anyways, and then Lola, for you, what is the worst part about having CF?
The worst part is that it's uncomfortable to go about daily life because regular activities that most people would be able to do easily is more difficult for us. Like running, sports, just eating in general. It's more of a chore than a fun activity. Yeah.
And what would be really cool about having a cure?
We wouldn't have to worry about all of that, and we wouldn't have to worry about all of these medical visits and tests and treatments and stuff.
Sure would be nice.
Yeah.
But we need money for that cure. So, yep. So if you're watching this and you're thinking about donating to the Cystic Fibrosis Foundation, we hope that this helps encourage you to donate more and donate often, because we need a cure and better medicine. Thank you very much.